Welcome back, my dear students. Today we are going to learn about vitamin A deficiency or VAD, a major nutritional problem that mainly affects the eyes, immunity and growth. It is one of the leading causes of preventable childhood blindness in the world, especially in developing countries. Children with VAD may suffer from night blindness, dry eyes, bare spots, corneal damage, frequent infections, and poor growth. But the good news is VAD can be prevented through a healthy diet rich in vitamin A, like green leafy vegetables, carrots, papaya, mango, milk, eggs, liver, and fish, along with supplementation programs, food fortification, and health education. Vitamin A deficiency or VAD introduction. What is VAD? Vitamin A deficiency happens when the body doesn't get enough vitamin A from food or cannot absorb or use it properly. It mainly affects the eyes, causing night blindness and even permanent blindness, but it also lowers immunity, growth, and reproduction. Epidemiology: one of the leading causes of preventable childhood blindness worldwide. It is caused by poor intake of vitamin A rich foods, poor absorption, and repeated infections like measles and diarrhea. High risk groups: preschool children, pregnant women, and lactating mothers. Why is vitamin A important? Vision: it is needed to make rhodopsin in the retina. It helps in night vision. Epithelial health: it keeps skin and linings of the eyes, lungs, gut, and urinary tract healthy. Immunity: it protects against infections like measles and diarrhea. Growth and development: vitamin A is essential for normal body growth. Causes of VAD or vitamin A deficiency: dietary deficiency, not eating enough vitamin A foods like green leafy vegetables, carrots, papaya, mango, milk, eggs, liver, fish, etc. Poor absorption: it occurs in liver disease, pancreatic problems, or fat malabsorption. Increased demand in children, pregnancy and lactation. Frequent infections like measles and diarrhea drain vitamin A reserves. Prevalence: globally, WHO estimates nearly 190 million preschool children are subclinically deficient. India: around 0.3 to 0.7% of children show visible eye problems like xerophthalmia. 40% to 50% of children have low vitamin A levels in their blood, so it is hidden or subclinical deficiency. So the signs of vitamin A deficiency are night blindness, dry eyes, bare spots, corneal ulcers, and risk of eye infections. Clinical features, that is ocular or eye manifestations, like WHO classification on xerophthalmia: XN means night blindness, X1A is the conjunctival xerosis or dry conjunctiva, X1B this is barred spot or foamy patches on conjunctiva, X2 means corneal xerosis or dry cornea, X3A corneal ulcer or keratomalacia, X3B corneal ulcer or keratomalacia, XS that is corneal scarring or permanent blindness. Extraocular features: frequent infections like measles, diarrhea, respiratory infections, growth retardation and anemia. So we need to know that is top 6 health benefits of vitamin A. It supports immune system health, it contains anti-inflammatory properties, it supports eye health, it helps block environmental toxins, it aids in showing the aging process. It supports bone health. Prevention strategies: dietary approaches: eat vitamin A rich foods, green leafy vegetables, carrots, pumpkin, papaya, mango, milk, eggs, liver, fish, etc. Supplementation: India's national prophylaxis program, 6 to 11 months, 1 lakh international unit of vitamin A orally, 1 to 5 years, 2 lakh international unit every 6 months. Public health measures: control infections, especially measles. Nutritional education for families. Food fortification, adding vitamin A to oil, milk, etc. Quick recap for the students: VAD or night blindness, bird spots, corneal problems, and it causes preventable blindness. Risk groups: children, pregnant and lactating women, Prevention, good diet plus supplementation plus infection control plus fortification. In today's class, we learned that vitamin A deficiency is a serious nutritional disorder that mainly affects our eyes, immunity and growth, and it is a leading cause of preventable childhood blindness in many parts of the world. The common signs include night blindness, biot spot, corneal damage, poor growth, higher risk of infections. So the good news is VAD can be prevented and controlled through a diet rich vitamin A, regular supplementation programs, food fortification and proper health education. Remember, eat plenty of green leafy vegetables, carrot, papaya, mango, milk, eggs and fish, and protect children from infections like measles. Stay healthy, take care of your health and keep learning. See you in the next class. Thank you.